Hi, this is Dr. Wilcox. I have a patient here, David. He's one of my larger sized people coming in here. And people wonder about chiropractic care, whether or not a chiropractor can adjust a person of his size successfully. And the answer is yes. I'm not big enough to do a manual adjustment like the traditional chiropractic care would be, but I've been using a computer now for 8 years. And we're going to show you what a computer can do to adjust him. And you kind of get a feel for it because he comes in here periodically to get his back and neck taken care of, and I'm going to show you how it goes. So we're going to use a computer to do that tonight, the PulseStar computer, the only one in north central Kansas. I'm going to have you put your head in here. We're going to do an analysis first, and every time I touch him, it's going to tap him 4 times, make an average stiffness reading of what's going on with that vertebra.
Thoracic.
And then the computer just tells me what to do, so far anyway.
Lumbar. Sacral. C7.
And we're going to go right up to the neck first. So the computer picked this one out as a
15,
vertebra
20.
that need to be stuck, unstuck, freed up the most. So right up here at C7, right at the base of the neck. Then
L5.
we go to L5. Because I've worked on him, David, before, I know I want to go to the right side of his low back for L5 here. I'm going to kick it up to
25, 30,
as high as it
35.
goes. So it's acting like a little jackhammer. It's a mechanical force from the computer using a piezoelectric sensor and this impulsing. There's no recoil in my hand. It all goes into the body. That's one nice thing for me. I don't wear out that way.
L1.
And we're going to L1 next.
25, 30, 35.
And that's how many PSI go in there. It picks up a subharmonic of what that vertebra's moving at and changes in real time if you can hear the change of the speed.
C6.
Go back up to here.
15, 20.
Tap that one.
T2. 20, 25.
Right here.
Adjust. 30,
I
35.
know from experience this next move helps him, so I come right into here. And this also works good on disc problems. He doesn't have a disc problem, and it does work good at disc. I'm going to come right in here. I want you to sit up and bend back right where I'm tapping you. And I'm going to lift that right up in there like that. Come right on back, David. Come on back. Very good. Back down now. We're going to do a rescan,
Cervical.
and we'll see what happens here.
Thoracic. Lumbar. Sacral.
Good. We've got a reading over here. If you can come in over a little closer with the camera. He came in looking like this. There are 2, 4, 7 red bars. He still has some red bars, but the red bars show about the joint relationships. But overall, the local decrease of stiffness is 10% right here where I adjusted him. Overall, 7%, but locally, the vertebra adjusted 10% less stiff. So, might mention, how's that feel, David?
Feels good.
Feels good? You want to get up and walk a little bit? You can walk back out that way. How's that feel in your back now?
Feels really good.
Feels really good. Great. Okay, well, we'll check you out your next visit.
Okay.
Yeah, okay, take care. It's good to see you again.
Thank you.
You're welcome. Okay.